We're diving into something truly groundbreaking today, a medical breakthrough, really. An implantable device that, well, it taps into your body's own power to heal itself.
It's fascinating
It
stuff.
really is. And we're going to unpack exactly why this is such a big deal.
Yeah, today we're taking a deep dive into neuroimmune modulation. That's basically the connection between your nervous system and your immune system,
Yeah.
how they talk to each other.
Right.
And specifically, we're looking at a brand new FDA approval. It's for a vagus nerve implant designed to treat rheumatoid arthritis.
And this isn't just, another drug. It feels like a whole new way of thinking about autoimmune diseases, moving away from just suppressing everything.
Exactly, towards helping the body regulate itself.
So our mission today is to figure out how this great nerve, the vagus nerve, actually works, why this approach is, well, so significant, and what it genuinely means for people dealing with these chronic conditions.
And our main source for this is a great piece from IFL Science. It's titled, First of its Kind Vagus Nerve Implant Gets FDA Approval as a Therapy for Rheumatoid Arthritis.
Okay, so let's get into the big news then, the FDA approval.
Right. So the U.S. Food and Drug Administration gave the green light to this device from a company called SetPoint Medical.
And the mechanism, that's this really revolutionary part, isn't it?
Absolutely. It's what they call a neuroimmune modulation device. It sends these little electrical pulses, stimulations, to the vagus nerve just once a day.
Just once a day. And that stimulation, what does it actually do?
Well, it kickstarts the body's own sort of innate anti-inflammatory pathways. The article puts it nicely. It's like prodding the body to use the tools it already has to get inflammation under control.
I like that framing. Prodding the body. It highlights why it's so different, right? It's managing the disease without just shutting down the immune system wholesale, which is what so many current drugs do.
Precisely. It avoids that broad suppression. And what's really interesting is that this targets a part of our anatomy we've known about for ages.
The vagus nerve itself.
Yeah. Dr. Kevin J. Tracy, he's a co-founder of SetPoint Medical, and actually wrote a book called The Great Nerve. He points out there's, well, quite a bit of misinformation floating around about the vagus nerve.
Right. You see a lot online. Some of it may be a bit simplified or even misleading. So what's a common misconception this breakthrough helps clarify for people?
Well, I think a big one is viewing it as just like a simple on-off switch for relaxation, or thinking it's just one single nerve pathway.
Okay.
The reality is much more complex. It's this incredibly intricate network. Dr. Tracy describes it as carrying signals back and forth between your body and your brain that maintain a balanced function of all your organs so you don't have to think about it.
So it's automatic.
Yeah.
Like breathing.
Kind of, yeah. It's about these innate reflexes. He calls them healing reflexes or healthy reflexes. They get activated when something changes in your organs. Heart, kidneys, gut, whatever. It's your body trying to maintain balance automatically.
So this device isn't forcing something unnatural. It's more like nudging a natural process back online when it's gone off track.
That's a great way to put it. It's engaging those inherent reflexes rather than just, masking the symptoms.
Okay, so that's the function. What about the nerve itself, the physical structure? You mentioned it's not just one nerve.
Right. It's often called the vagus nerve, but you actually have two. There's one running down each side of your body.
Huh. I didn't know that.
Yeah, and each one is made up of about 100,000 nerve fibers. So that's 200,000 fibers in total. It's a massive communication highway.
Wow, 200,000. And it's critical for survival, right?
Absolutely vital.
Okay.
Dr. Tracy stresses this point. He says, it's the only nerve in the body that if you cut it on both sides in the neck, it's fatal. You die.
That's stark. It really underlines how fundamental it is.
No kidding. And, this isn't a new realization. Galen, way back when, often called the world's first scientist, he recognized its importance. He called it the great nerve.
The great nerve. That name's stuck for centuries, apparently.
It did. And knowing how vital it is, well, it starts to make sense why stimulating it could have such a big impact on something like rheumatoid arthritis.
Yeah, let's talk about RA. It's such a challenging condition.
It really is. It's a chronic autoimmune disease. Affects over 1.5 million Americans.
And it's debilitating. Your immune system mistakenly attacks healthy tissues, especially in the joints.
Right, leading to chronic pain, inflammation, bone erosion. It can really reduce mobility and quality of life.
Yeah.
And crucially, there's currently no cure.
So people are managing symptoms often with pretty heavy-duty drugs.
Exactly. Current treatments often involve what are called disease-modifying anti-rheumatic drugs. These can be biological or targeted synthetic.
Yeah, they have drawbacks.
They definitely can. The source highlights that the tolerance is a big issue for some patients. So much so that around half 50% stop taking their prescribed therapies within just 2 years.
50% in 2 years. That's a huge number. Does that suggest, even if this implant works, keeping people on the therapy might still be tough? Or does the implant itself kind of solve that problem?
That's a really important question. And I think the implantable nature does inherently address the adherence issue.
How so?
Well, once it's implanted, the therapy is delivered automatically every day without the patient having to do anything. No pills to remember, no injections to manage.
Ah, right. It takes that daily burden away. That must be a huge part of why people stop therapies.
It can be a major factor, yeah. So this set point system aims to be a long-term solution. It's this implantable device designed to, as the article says, hack into the great nerve.
That phrase again, I like it. It's stimulating it once a day.
To activate those built-in physiological pathways we were talking about, helping the body control the inflammation itself.
And this FDA approval wasn't just based on theory, right? There was a clinical trial.
Oh yeah, solid evidence. It was based on a randomized, double-blind, sham-controlled study.
Okay, break that down, sham-controlled.
It means some patients got the real stimulation and others got a placebo or sham stimulation. Neither the patients nor the doctors knew who got what until the end. It's the best way to really test if the device itself is having the effect.
Got it. And the study size?
242 patients, which is pretty significant for this kind of trial.
And the results were positive.
Very positive, it seems. The therapy was reported as well tolerated. Serious adverse events were low, only about 1.7%.
That's encouragingly low.
And here's a key point for long-term management. The device is actually programmed to deliver this therapy for up to 10 years.
10 years, wow. That really speaks to the potential for long-term relief without needing daily pills or injections.
Exactly. It's thinking about chronic disease management differently. And experts are taking notice.
Like who?
Well, the article quotes Dr. Mark Richardson. He's the director of functional neurosurgery at Mass General and a professor at Harvard Med School.
Okay, definitely knows his stuff. What did he say?
He said, the approval of the set point system highlights the potential of neuroimmune modulation as a novel approach for autoimmune disease. Basically, using the body's own wiring to fight inflammation.
Harnessing those neural pathways.
Yes. And he also pointed out that it simplifies care for people with RA. Think about that. Fewer doctor visits, potentially, less complex medication schedules.
That simplification alone could be a huge quality of life improvement.
Absolutely. Less burden on the patient, less burden on the healthcare system, potentially. It really feels transformative.
It does. When you step back, the implications feel quite profound. It really could signal, maybe not an end, but a new type of beginning in how we treat these diseases.
Using the body's inherent wisdom, those healing reflexes.
To manage conditions like RA long-term, potentially improving quality of life significantly, and maybe, just maybe, without the heavy cost of broad immune suppression.
Yeah. It's really hopeful.
It really is.
And, thinking about the vagus nerve as this critical information superhighway and seeing how we can now gently interact with it to manage inflammation, it definitely makes you wonder, doesn't it?
Wonder what?
Well, what other innate physiological pathways are lying dormant, What other built-in healing systems might we discover? And could we learn to gently prod those too, unlocking even more of the body's incredible capacity to heal itself in the future?